Hi viewers, welcome back to my YouTube channel. Today's video is on the causes of dyslexia. I'll also be laying emphasis on some types of dyslexia. Dyslexia is no disorder, but the causes are not really so pronounced. But these factors, these pointers, I'm just going to give some pointers to some causes of dyslexia. And one is that inheritance of genes that are related to dyslexia, and this condition runs in the family. For instance, you could have that because I have said that dyslexia could be developmental, which is primary or secondary. So at the primary level, you have this dyslexia gene that runs in the family, and it can be transmitted from one generation to another or from one person to another through the gene. Another cause of dyslexia is due to premature birth or low birth weight, when a child is not born termly, or when a child is even born termly and the weight is below what is expected. So you have that child might have dyslexia. Exposure to harmful substances such as nicotine, drugs, alcohol during pregnancy may affect the fetus brain. So when the mother is pregnant with a child and you find out that the mother is into nicotine, alcohol, drugs, that may affect the child brain, the ability, the functional part of the child's brain, and the child might come down with dyslexia. Also, when there is brain development of the fetus that alter due to infection, if there is developmental impairment in the brain of the child as a result of infection. Some women, when they are pregnant, they are not able to really take care of their body, and they might come down with infection. During pregnancy, it can also affect the functionality of the child's brain that may lead to dyslexia. Also, there are different parts in the brain that are responsible for one thing or the other. If the part of the brain that is responsible for reading and comprehension is affected due to maybe the drugs, the infection, the child might also come down with dyslexia. Also, especially to stress at a very young age. When you expose children at a very young age, for instance, when children are born, they might come with some complications. A lot of drugs, a lot of things are being given, and if those things have some kind of effect in the part of the brain that is responsible for reading and comprehension, the child might come down with dyslexia. The brain injury as well, not just for children this time around. Adults can come down with brain injury due to accident or one thing or the other. There can be stroke, it can be dementia, and these things also display symptoms of dyslexia. So when we have these pointers, when we have these possible things that can cause dyslexia, we should really watch out for them. The types of dyslexia we're also going to talk about: the phonological dyslexia and the surface dyslexia. Phonological dyslexia, let's start with that. Phonological dyslexia is a type of dyslexia that presents with difficulty with phonemic awareness. What does that mean? It means that the person has difficulty or problem or challenges identifying the latest sounds. It's finding it very difficult to identify the latest sounds in words and then blend those sounds into words. It also means that the person might have difficulty to break down words into syllables and connect the letters and the words to the sound that they correspond to. For instance, if I have the latest sound a and the latest sound and I'm able to bring the two latest sounds together, which gives us the article an. So I'm able to do that because I am very phonemic. My phonemic awareness is intact. But people with dyslexia may find it very difficult to blend these sounds to form words. Also, when I have a word, words are segmented when we want to pronounce them. So we can have one word that has 2 syllables word, 3 syllables word, 4 syllables word, and so on. So people with dyslexia, for instance, the word foundation. Foundation is a 3-syllable word. So someone with dyslexia will find it difficult to segment this word into their sounds or into their syllables and bring it together to pronounce. A person with phonological awareness has inability to do that. Is not able to do that foundation. So you might have difficulty in pronouncing the word foundation because he's not able to segment into syllables the words that make up the syllables that make up that word. It's very, very important that we are aware of this type of dyslexia, because a lot of people in school, a lot of learners in school, they have this challenge of phonemic, phonological dyslexia. Let's go down to the second type of dyslexia, which is what? Surface dyslexia. Surface dyslexia is the inability to read words that are spelled differently from the way they are pronounced. That means the person has inability to read words that are spelled differently from the way they are pronounced. For instance, the word sight, which has to do with vision, sight. So if I ask a lot of people to spell sight, they might spell it like S-I-T-E, and some other person might get the spelling, which is S-I-G-H-T, which is sight. So people with dyslexia, surface type of dyslexia have difficulty to pronounce these sight words, because the way they are written is different from the way they are pronounced. So you look at it very well. You say, oh, spell thorough. The child is not able to spell thorough because he's trying to figure the word thorough. How will I spell thorough? And we'll come up with something else. So the problem with a surface type of dyslexia is also known as visual dyslexia. It is not the sight. The sight is not the problem. But where the problem lies is the brain. The brain is not able to do that translation. The brain is not able to transmit properly for the person to pick these sight words, be able to pronounce and sound them or write them up, that knowing that they are sight words, they are spelled differently, they are not spelled from the way they are pronounced. In my next video, I'll be talking about in details the other types of dyslexia and the signs that follow them. It's very important we mark this, because yes, dyslexia is dyslexia, but there are subtypes, and the earlier we identify the type, the way of intervention, so it will affect our way of intervention. Because if somebody is having surface dyslexia and you are treating phonological dyslexia, it's not going to help. So right diagnosis for the type of dyslexia will give birth to right intervention, and that will help the child to improve better. Continue to watch our videos. Please subscribe, share, because this information is very important. Share to teachers, share to parents, because they need to know. Thank you.